Good afternoon. This is Serena. I am with Group 7, and today we'll be talking about the COVID-19 epidemic and the vaccines used. A little bit of a background about the coronavirus COVID-19. The epidemic started in China in late 2019. It entered the United States by early 2020. In the United States alone, it has killed more than 1,070,000 people. Some people develop what's called long COVID, where they have symptoms that last for weeks or months after the actual virus has left their body. The more COVID spreads, the more it can mutate, change, and create variants. At the moment, there are 5 recognized variants, Omicron being the latest one, with several subvariants under that. COVID-19 can be spread by a sick person who breathes out particles. These particles land on people's eyes or are breathed in by someone. They can also contaminate surfaces that people touch. Some of the analysis that we will be presenting today is the comparison between different continents, total cases, people vaccinated, age groups, smokers and non-smokers, cardiovascular deaths, diabetes prevalence, vaccines chosen based on GDP, and all these are to show the different effects of COVID and the different popularities of the vaccines in different countries. The reason this is important is because it's good to know which vaccines may be more effective, whether a country chose a vaccine for a certain reason, like possibly the GDP or the population of the country, whether the vaccine or the age group or the fact that someone's male or female or smoker, if any of these variables affect the death rate or the case number or anything like that as far as COVID-19. And the reason this is important is because this is a very big epidemic that affected the world, and we would like to know how we can prevent this going forward. For the next epidemic, it'd be nice to know the different factors that could affect the virus. The first spreadsheet that I created was one to compare the different vaccines based on the average GDP per capita. I did this to see if maybe one vaccine was favored over another because of the GDP. What I found was there wasn't really one in general or two that were favored for the lower GDP. It does look like, though, that the higher the GDP, they did have more variety of vaccines that they used. Another thing that I noticed is that the Oxford AstraZeneca and the Pfizer were 2 very popular vaccines that spanned a good majority of the GDP range. The second spreadsheet that I created was one that shows the different countries and then the total cases per million in each country, and then the daily vaccinations per million for those countries. And these are all averages. And there is a slight correlation with this. You can see that Africa, which is the lowest total cases per million, also had the highest daily vaccination average per million. So that may be why Africa had a lower total case than the rest of the countries. The rest of them didn't really have too much of a variation. They had on the lower range to like mid for daily vaccinations per million, and they did range a lot higher. This could show that vaccines do work and help against new cases of COVID-19.
Hello all, this is Lakshmi Pooja and I belong to Group 7. We are working on a project called COVID-19 dashboard. We have done both Tableau dashboard and also a PPT presentation on the same. To start with, the first comparison or the first visualization which I chose is vaccine comparison between different age groups. So the main idea of this comparison is that I just want to compare, for suppose this is the vaccine name and this vaccine was used in which continents, and for the two age groups, that is age 65 older and age 70 older, how many vaccines were used. So I just wanted to compare them. So for suppose if we take this vaccine, it was used only in Europe, and in Europe age 65 older, for suppose, and these are the countries for that specific continent. So for suppose if we take Italy, the total vaccines used were around 1000, this much, around 1300, and age 65 older people were around 1220 people who have taken this vaccine in Italy in Europe. So this is pretty much about this comparison. This is the same for all other vaccines. For suppose if you take Pfizer, where it is used in North America, in Asia, in Europe. So in which continents it has been used. Some vaccines have multiple continents. For example, if you take Pfizer BioNTech, it has been used in South America, North America, Asia, Europe, 4 continents. And I just compare the countries of specific. Suppose if you take North America continent, the country in it, Mexico. So the Pfizer BioNTech was taken by age 384, aged 65 older. So in this way I have taken, this is just a comparison about the vaccines taken of two different age groups, and these two age group fields was directly taken from the dataset. The second one is the total population was the total deaths. We all know that COVID-19 has played a very vital role and many people have died due to the disease, and this is just a comparison of that in different continents specific to the dates 2020 and 2021. So coming to Asia and 2020, the total population and the total deaths happened, and this figure is the total population and the total deaths happened. We have taken it in the 5 continents. The next comes the most interesting one. It's the vaccines versus location map. What I did in this is that I have taken the longitude and latitude in the columns and the rows area. So based on the map, based on the country, I have done the bubble chart. So the vaccines, these are the vaccines which were totally used all over the world for the COVID-19, and I just wanted to compare which vaccine was used mostly at which region. This was the pretty much comparison. For suppose if we take modern Pfizer BioNTech, this the color of it is green. In United States, the most of the vaccines of modern Pfizer BioNTech were used. The total vaccinations was 1000, around a lot total vaccinations. So the higher the number of vaccinations, the greater is the size of bubble. So when we go here, when we compare United Kingdom, we in that country, the vaccine used were Oxford AstraZeneca. So there the total vaccinations figure and we compare it to the United States. United States is bigger. So this has a bigger circle than this. And yeah, I have taken the vaccines in the color. I have differentiated the colors of the vaccines by placing the vaccines column in this. And then the sum of the total vaccinations. So I have taken an aggregate value by doing the size and the location. I have placed it in detail. The reason being is, suppose if we place this in text, we get the exact name of the countries here too. For example, this is United States and this is Israel and this is Morocco. So in this way we get the exact names of it also. And the final one is to compare total vaccinations versus location. That is, United States has the highest amount of vaccinations done during the COVID-19 outbreak. The number of vaccines is given here. And next comes United Kingdom and the order of the countries. It's just the order of the countries. It goes until down. So total vaccinations versus location. In this way it is done. Based on the data what we have, I have done these 4 vaccine comparison between different age groups, total population versus total deaths, vaccines versus location map, and the how did I get the location map is that I have changed the attribute continent and location to geographical role while I was importing the data. In default, it would be taken as a string. Then we need to change it to geographical role so that we get this map. That's it from my side. Thank you.
I'm Raju from Group 7. I have done some visualization using Tableau. I compared the total number of COVID cases of male smokers and female smokers. The spread of COVID-19 is too fast and affected lots of people. But most people with smoking habits and other health problems. Here in worksheet 1, I am discussing the people who have smoking habits, diabetes, and the health problems that led to the cardiovascular deaths in the next worksheet. Worksheet 1. In this worksheet, I have compared the female and male smokers with the total cases by continent wise. You can see the continent wise: Europe, Asia, South America, and North America, and Africa. I have used the side by side bar to do the comparison. Here you can see these. This is for the female smokers, and this bar is for the male smokers. Uh, it is for divided for each and every individual continent. I have taken 5 here. So when you place a cursor here, you can get to know the number of male smokers, a total number of cases. For example, if you see here, if there is 95,460 cases, out of which the male smokers of 48 male smokers are there. So I have done this visualization using side by side bars. And in my second worksheet here, in the second worksheet, I show the visualization of total cases and cardiovascular deaths and diabetic prevalence in 2 different years. You can see the 2 different years here. 2000, this one is 2020 and this one is 2021. The blue color indicates 2021 and red color indicates 2022. From the visualization, it seems most of the cases and deaths are in 2020, 2021, then in 2020. Even though COVID started in 2019, it's most spread in 2021. I have added the location-wise data to do this. So first we have most cases from the United States. When we sort here, we can see the most of the cardiovascular deaths rate are from Russia. And also when we sort here, you can see most of the cases were from Bahrain. So from this comparison, we get to know that So there are lots of cardiovascular deaths that because of COVID, and also the diabetic prevalence. So in United States, you can see the cardiovascular death rate was 7,252 in 2021. Also in 2020, the cardiovascular death rate was 1,813. So when you place the cursor, it shows you the total number of cases along with the cardiovascular death rate and the diabetic prevalence rate in 2021 and 2022 individually. So I have used the horizontal bar for these. So I have filtered some data using these, and also used some different colors to indicate the two different years.
Hi, myself Molika. I have done visualization in Tableau by using the COVID dataset. Here is the first one, which is comparing the vaccine doses depending on the continent. Here I have taken an fully people who are fully vaccinated on the y-axis and the name of the vaccine in the x-axis. Here I have shown the which vaccine is used in which content and the count of the people who are fully vaccinated with this vaccine. For instance, if you take the vaccine which is called Moderna, Pfizer or BioNTech, it was taken in three different continents, which is Asia, Europe and North America, and it also shows the count of total number of people who are fully vaccinated with this vaccine. And next here is total number of new cases in 2020 and 2021. Here I have taken a year through which I have extracted the month, and it will show us a clear idea on which year in which month the new cases arise. For instance, if you take the North America, here it is clearly shows that in the month of the December in North America, which is in the location called Canada, in the year 2020, the new cases are 9,573, and if you compare these cases with the next year January, that is 2021 January, the cases are more than the December 2020. And if you also seen if you compare the new cases in February 2021, the new cases are little bit less than the January 2021. Here in February, it was clearly stating that the total number of new cases were little bit low than the January 2021 cases. And next one is the population versus people who are fully vaccinated. Here I have taken the tree map. It will shows in an square boxes. If the square box is too large, and it will show us that the population and the people who are fully vaccinated is more, and this is how it will work. And it was clearly shows that in which location and in which year people are fully vaccinated and the total number of the population in that year. Thank you.